We are live streaming. That's how it generally goes.
Hi, everybody. It does, I know, isn't it crazy? Zoom, it's like you're going live and you're actually live. Here we are, another Holistic Vet Sisters, and I'm back. You missed me last week, didn't you? Just that 1 week off. So we are here again at 6 p.m. UK time to answer your questions on natural veterinary care. And today is Dr. Lise Hansen and myself, Caroline, specialising in nutrition, of course, and Yida, who it doesn't look like that's how you say it, but that's how you say it. And she's in Denmark, another holistic vet in Denmark, which is great. Lise, you are pulling out all the vets from Denmark.
Yeah.
This is great. There's loads over there. Loads over there. People of Denmark are blessed, I think. So anyway, we're not going to waste too much time. We're going to talk to Yida, and then we're going to look at some of your questions. So, do you want to give us a sort of rundown? What sort of veterinary modalities do you practice?
Thank you, Caroline. My name is Jette Christensen. I have been working as an integrated vet in 25 years now. And I've been so lucky that during vet school, I met very great people working with alternative medicine. And so I met Lise already at a course 25 years ago, Lise.
Wow. Yeah.
Wonderful people. And so already during vet school, I could have the alternative medicine along with the conventional. And I have really been blessed with that. In my first workplace, there was another homeopath working with dairy cows. So we had a really good companionship with taking care of the dairy cows at risk. So we visited the farmers once a week to help them, the cows at risk. Later on, I got the chiropractic education in Germany and was very happy about that. But some of the problems the patients had came back. So Reggie Schultz, that you have had as a guest some weeks ago, she persuaded the wonderful physiotherapist, Patricia Kortekos, to come from Oregon, US to Denmark to lecture in osteopathy in indirect techniques. So I was just lucky to be in the right place at the right time. And the chiropractic and the homeopathy and the osteopathy with the indirect techniques makes it possible also to help the lymph fluid. So we learn a lot of conventional things and pathology and stuff in vet school, but it's like that pain is more about that you have swelling and stagnation in the lymph fluid. But we don't have very good ways of measuring it. So it's like we forget a bit about it in the daily life. But along with Lisa and Jeff Johnson had a wonderful homeopathic course in Denmark, and our group, after we had graduated there, we took the Dynamis course in Dublin with Jeremy Scher. And I am so lucky that it has been possible to meet all these great people, David Lilly and Peter Gregory and Jeremy Scher, people that have been working so much and helping so many patients all over the world. In the beautiful area where I live, there are more people loving hunting than there are vegan people. So it's like not many people know so much about homeopathy, but there are many patients that have chronic problems. I enjoyed the post that Purple Vet put up about chronic, that we tend to make our patients that dogs and cats will be more and more chronic ill because of bad food and much vaccinosis and bad treatment in many ways. So it's really nice that that you help people to get connected with good skilled people that work with integrated techniques in different ways. In my workplace, I focus now on challenging patients, so that when I see a patient, I connect both the chiropractic with the direct techniques and osteopathy with the indirect techniques, and then fascia lines that Rikke Schultz talked so beautifully about. And then the lymph will work much better, and the patient gets much happier and livelier. Some of the cases could be liver patients with a swelling of the liver, or patients with where the blood samples that the kidney values are going up. It could also be patients that are angry and sore because they have arthritis and tension in the connective tissues. So I experience that it's very often multimodal cases, and I always send the pet guardian a mail and instruct them that I would like them to remove gluten and grain the day before, so that they check the treats and they check the food if there are wheat in it, and make sure that they feed the dog with something else 24 hours before they come to me. And then they bring the harness, and they come 2 people, so that they can have a chance to remember all the things that we talk about the vital health. And it's a family member when they come with their pet. Or it's really important that it's in a nice, cozy environment. So when they arrive, I go out to them and see the dog, how it behaves and how it runs outside, and take a little video clip. And then when we come inside the clinic, we have a little game. So I throw a treat to the doorway, so that I stand beside the examination table, which is lowered very low, and then I toss a treat, and the dog can run for it. And when we do that 2, 3, 4 times, it explores that it can jump on the table and be allowed to jump down again. And then it's much more relaxed to stand on the table afterwards to be examined. And then I check the nervous system to see if the proprioceptive reflexes are fine, or if there are problems with the cranial nerves or the pupillary reflexes. And then the lymph treatment, it's only a 5-minute protocol to make that function ideally. And then I use direct chiropractic technique on the pelvic and on the pelvic area and the last lumbars. And then the rest of the body, I will check all the joints with osteopathy indirect techniques. And then I use the tuning fork to make the connective tissue and the fascia lines function optimal. Maybe you remember the book from Rikke Schultz, Rikke and Vibeke and Tove have, it's really a brilliant book, and they have been so wise that they, on the last page, have put in QR codes, so that when you read the book, and if you have a horse at home, you can see videos how you make the swing test to check if there are tension in the connective tissues.
For owners or for vets?
It is for professionals. But I would, if I had a horse, I would definitely buy it and help my own horse at home.
So the procedure that you just described when you welcome a patient and how you approach them and what you do first, is that all patients, or is it patients that come with locomotor issues, or would it be any patient, or do you mostly see patients with locomotor issues?
So most of my patients have locomotor issues, pain, behavioral issues, sometimes difficulties with their blood, liver or kidney or skin problems. It's often that they have more than one problem.
Yeah.
But of course, sometimes I see a puppy just for core vaccination, and I check them too in the same way. I play with them too in the same way, but I do not expect a little puppy to jump up on the table.
But does that mean you get the tuning forks out for all patients? Yeah?
I use the tuning fork for all patients.
So tell us a bit more about the tuning forks.
Yeah, I know what hurts.
I knew. I promised Caroline I was going to get someone to come in and talk about tuning forks. Here we are.
This is the most inexpensive but valuable tool I have. I use it every day. I have a small one in my bag if I travel on holiday. I never leave my home without one, because there can happen something with your family, your children or your dog, or it's like Tove Dur, the vet that together with Rikke Schultz have made this book. She has more skills than I have. It's like she can almost make a lamp bulb light with just holding it. She is just pure energy. But if she checks, if we look at a fascia line, then she can feel where the acupuncture point is to release a whole fascia. So Tove, she uses acupuncture points and acupuncture needles, and it is quicker to use an acupuncture needle. But I have chosen to use the tuning fork always because some of my pet guardians, they find it is a little bit hocus pocus to, do you say that in English?
Yeah,
a little bit hocus pocus. To use a tuning fork at a vet, that's strange. And pay for it, that's even more. But if they see that I can make it work, they can see their animal enjoy it and relax, and the pain goes away, and that in an hour, I can stretch it in all directions, and it's much more flexible and feeling years younger. Then if both people in a couple, if they come and the skeptical one sit with a cup of coffee, and I put a little ball with chocolates so that they can just sit and relax and be bad, dårlig stemning, ikke?
They can sit there and feel their reservation, yeah.
yeah, you feel the reservation. But when they see that it works on an animal, that it works on their pet, then they will help their wife to do the tuning at home.
Do you ask people that both? Sorry to interrupt. Do you ask people that the whole family, you know, if there's a couple, that they both come?
Yeah, and
That's
if it's
really
a single person, I ask them if they can bring somebody else. It could be the neighbor's wife. It doesn't matter. it can be very nice to be two, at least when they drive home from me, they can discuss it in the car, just to get it more settled in the brain, because for some people, it's really, everything is new, what they experience when they come into my clinic.
Yeah.
Chiropractic for animals.
But what is the frequency or the hertz that you are using? Is this...
Yeah. This one is 128, and it's the C tone.
Right. What made you choose that one?
It's effective and it's cheap. You can get 440. It's a little short one, and it's the tone A, and it's also effective and cheap, and it can be easier to use on the inner thigh because it's shorter. Because when it's activated, if you touch it, it will slow down. Yeah. So and then you can get even longer, 64 and 32 hertz, and they are very long, and they are heavy and a bit impractical to use, because maybe it's 25 points you have to treat on the animal. So this is cheap and convenient, and it lasts. It never breaks. I have never heard of. Yeah, this is good, and it's good for both people and animals.
Of course, I actually have done quite a few courses in this. I've got lots of forks, but the course that I did, it attuned them. They did tell me the musical fifths and the musical this, and but I've forgotten what they were now. I'll have to look them up again. But it's interesting because it's all part of this spectrum of frequency that is related to sacred geometry and is related to the water spiral.
I think
all of life.
You also know the bowls, the klangskåle, Lise.
The singing bowls. What do you call those?
Singing bowls.
Yes. Bowls or gongs or
it's also very nice, but it does not work as specific.
Of course,
as we needed here.
Yeah, because I was learning to put them on the acupressure points as well.
So how does it? I mean, what do? You make it make a noise, and then you hold it to the point that you want to affect.
I activate it, and then I turn it so that this point goes on the point, so that it is the vibration we shall use for the relaxation of the fascia.
So it's not the sound in the room; it's the vibration on the skin.
It's like
you can put it in the field if the animal is not keen on you putting it directly on them. But for most animals, once they get to trust you, then they will allow you to.
Most animals find that it's tickling too much on the toes, so don't start there. I always start in this area, because it's on quite big muscles, and they get more, and then I always start in the behind and not close to the ears and the cranium, because it really the sound is more not violent, but forceful, so close to the ears. They need to have a bit time to find out that this is a good thing. But you do a little swing test to find out if the fascia is restrained, and then you put the tuning fork on the point, and then you do the swing test again. So you can repeat that several times until it's where it should be. And then you take the next fascia line. It's so effective, and it does not take long. And it's like the chiropractic treatment is very fast. I can do an animal in 10 or 12 minutes, but it does not last. The effect does not last. Maybe it lasts for a week, and then 2 weeks after the treatment, they would like another treatment, because when the fascia has not been released, then they will pull the joint odd again, instead of staying in the right direction.
Right.
So the tuning forks are to release the fascia so that it augments the osteopathic or chiropractic treatment. Is that yeah?
Yeah. So I do the chiropractic and the osteopathy first to make sure that all the joints can move. And then I check the connective tissue after that, so that I'm sure that it will not just tighten up again immediately when they come home.
I think,
and that is the point, that that it's brilliant to be able to do it all in the same day. I think, people that go to the chiropractic every 2 weeks, and they do that for years. I did that for years ago, but now, because I can do some of the treatment at home myself, then it's not necessary to get myself checked so often.
But do you then get the?
Don't you think this is part of this is like part of the jigsaw puzzle, that we forget this?
Yes.
Lymphatic system, and with the fascia. I know we spoke about the fascia before with Rigge, but it's like we do forget about it. But it's like you can do all that, but then you do also need to think about the food, and then you need to think about the environment, and the enrichment for the all these things. But it's like, sometimes we can do the nutrition side of it so well that we go, why is it that the dog is still poorly? And then we haven't actually looked at something like the lymphatic flow.
My question to that is, I have had a dog almost 12 years old with the pattern of the gluten, that it was restricted on the right side of the body. So it was more tight over on the right side of the body. And it was almost 12 years old. And the owners knew that it had had a grain-free diet for 11 years, because they had another dog that had inflammation in the ears if the dog ate anything with grain. So from the arrival of the new dog, they had both had the grain-free diet. So that teaches me that it's really difficult to be a researcher in this area, because you cannot have just two big groups of dogs where the one get quality food with grain, and the other group quality food without grain. You won't have any differences, because the tension does not leave the body even though you change the food. I only get the difference because they change the food the day before they come to me, or 11 years before they come to me, and then I release the tension and they stay off the wheat. And I find that the wheat is the biggest sinner here. I don't find the problem with the barley or the rye or the oat. So it's not a big problem if they think that the dog should have oatmeal in the morning, as the children have, or it's just they have to stay away from the pizzas and the pasta with wheat in. And I have some owners, they used to give the dog some of the pizza, so now they order gluten-free pizza just to keep the German Shepherd okay in the back.
But that's often the way I find, that people bring their dog and then they learn, from seeing their dog get better, they learn about their own health. It's really interesting aspect. It happens all the time.
But I have some X-rays I would like to have shared with you, because can you see this point? If you imagine a puppy that have a problem with weed, then I sometimes see that the distance from the last rib and to the pelvic area is 1 centimeter shorter on the right side than on the left side.
Wow.
So if you imagine a puppy that is growing in all directions and have a chronic tension here from it's so tiny, then I believe that it's one of the problems for the hip dysplasia.
Interesting.
Because sometimes I see x-rays from a dog that have had x-ray done 1 year old and they were fine. And then 6 years later, it has hip dysplasia, very ugly on the right side. I've had a German Shepherd with that photos just yesterday. So the one is terrible and the other one is fine. So I find that it cannot be anything with genetics. If it was genetically a problem, both hips should be awkward. But sometimes the problem is that if they have problems with the wheat gluten, then the tension stays, and for exhibition dogs, then they will not stand straight. They will not be square with the paws. Then they draw the right paw a tiny bit forward. You have seen that a lot of time. So it's a sign if a normal dog does not is not able to stand with the paws in a square. It should not feel that it's more comfortable to move one leg forward.
And this is affecting behavior as well, because if their proprioception isn't balanced, they start to feel vulnerable in so many different situations.
And so this, if the lumbar and the pelvis are crooked, then sometimes the proprioceptive is bad on the left because it's crooked up here.
Yeah.
Oh, go on. Sorry. No, sorry.
I just think we totally have undervalued this aspect of canine holistic health. This over the years, you know, because I've sort of seen how it's expanded out, and I think it's tremendous. This book that they've done for the horses, we just want the dog version.
No, I think they've written the dog version, haven't they? Is it out yet?
I don't know. That was the answer.
They are lying it's just the last bit of it.
So it's not available yet, but it's nearly
very
here.
Yeah.
I wonder if it will be available and in English by next.
It is in English.
By next day.
It isn't. Yeah.
Oh no, sure. Before then, I think
you could fly over to the expo with some.
Yeah, I could. I absolutely could.
We'd all want them.
We will get one for you, signed by, what was it? Reggae. You renamed her Reggae.
Yeah, Reggae. Yeah.
Maybe Reggae can do a workshop, a fashion.
There were several jokes in there. She was called Reggae, and there was another one.
Fascinating.
Oh, that's right. Yeah, the fascinating Reggae.
Fascinating. Yeah.
Anyway.
Yeah. No. Absolutely. Absolutely. Reggae tours the world with her.
We need to do questions.
We do need to do questions. I have one question for Jette though before we do the other questions. Do you use the tuning fork kind of once in the clinic to release this tension and then they go away and they're fine, or do you get the owners to buy one and then they do it at home, or how do you tend to do it?
I think 19 out of 20 owners would like to buy one and get it with them home. So almost everybody say yes, we would like that, and then I use tush pens to mark the points on the animal. So that they and we take photos so that they can find the points again when they come home.
I can just imagine that's the kind of thing you demonstrate on a white Chihuahua, and then they've got a pulley or something, and it's like, where was that mark?
Yeah. And it's really difficult on the pulleys and on all the pulleys. And some owners, they decide at the second visit they cut the dog. They simply clip it. So if your area is full of shaved dogs with crosses on, now everybody understands why. Yeah. And people, they meet in the park and talk. You have also been at Jette's place.
Your dog is naked with crosses on it. We know where you've been.
But I have a postkatusser in all colors, so it works wonderful. And
so you could go, do you want pink or do you want...
Yeah. And sometimes we use a little dot of nail polish. Nail polish. Yeah. Yeah. People really work hard, but it's also one of the reasons that it's good that two from the household comes and see why do they pay money to get home with a tuning fork and a dog with small spots on, you know?
So that's also the reason, because otherwise the one person's going to come home and the husband's going to say, no way, we're not doing that.
Never again. Yeah. So,
that's a bit funny.
If you think of dogs with chronic diarrhea or puppies that have a giardia, sometimes they walk with a curved back for a month, some for years, and that is because of tension in the abdominal fascias. And there are points in the back of the back paw to release that. And then after that, sometimes they look 2 centimeters longer afterwards. And sometimes it also, because that it's so curved, it also look a bit choppy. And maybe the vet, the normal vet have told the owner, your dog is a bit overweight, thinking the vet thought it's very overweight. And the owner think, no, it's normal weight. And sometimes when it's just able to stretch what it wants, then it's not overweight. Then it's just normal and fine. And it's really beautiful to see.
Yeah.
Do you use it on other species than dogs? Will cats accept this, or have you used it on horses?
Most cats accept it. I have had Eric, the killer cat, some weeks ago. It hated to be at vets, but now it loves to come. It had hit by a car accident. So the pelvic, it had a pelvic fracture a year ago. And then continued to have pain. And it was just because it had subluxation here. And so I fixed it. And then the tuning fork with the owner home, but she could not manage to tune it at home. So sometimes it's possible, sometimes it's not. But here we have managed to make the treatment last. It does not come again. Because, because we use both the chiropractic and the osteopathy and the fascia lines, and So Eric is not any longer the killer cat. Now he's just sweet.
The cat formerly known as.
Yeah.
He's a happy cat now. He's a happy cat. He's not in pain. He's feeling good. Okay,
but tuning fork is really good also for horses. So horse people should really be aware of the book.
Yes. Yeah.
So interesting. Yes, questions. We had a question or a comment maybe from Jane with Puppy, who I think it was last week we talked a lot about osteoarthritis because Jane was asking about Puppy, who had become lame, and she'd been to the vet, and the vet said, I think this is early arthritis. And then we were talking about this kind of ladder of things that you can do for arthritis, and tuning forks were nowhere on there, but clearly they need to be on there. But starting with supplements, etc. And Jane says that Puppy has started on a supplement, but she has in the meantime noticed that she actually is always only lame in the room that has new laminate flooring. She's not lame anywhere else. So she thinks it's the the surface. Yeah. So she was saying, I'm going to continue with the supplement, but I'm definitely not going to change the floor. This is new floor. And my comment would be that I would absolutely put some rugs down. you know, or some mats
Yeah.
or something.
Yeah.
Sometimes there are rooms in the house that dogs are not comfortable walking, and it will make her, I mean, it'll make her slip, and it's clearly making her lame. So she's not walking in a relaxed and balanced way on that floor. So I kind of understand not wanting to tear up the new flooring, but I would either keep Poppy out of that room or put some carpeting so that she doesn't have to walk on the floor.
Put some carpeting, and then maybe she can find a chiropractic on osteopath in her neighborhood.
Yeah.
And if there is no one in the neighborhood that knows anything about the tuning fork, then she could be able to use the QR codes in the back. I know the swing test is for horses, but she can imagine that it's a small horse.
But there will be, I mean, Jane lives in London. There will be very qualified osteopaths and chiropractics, chiropractic vets around. And we did mention that last week as well. But I wouldn't, my comment would be that I wouldn't just say, oh, now I know why you're always lame in this room. It's the floor, because it's that ongoing, daily, low grade, you know, straining.
I think sometimes they are not slippery every day, but if they have slipped once, they can be very painful in the psoas muscle or on the gracilis on the inner thigh, and you can make those two muscles relax with the tuning fork, and then you can make the if they use a little painkiller, it will work much better. And then they'll use the carpets.
Yeah, absolutely. It sounds like Poppy is not lame outdoors, and she's not lame in other rooms. She's lame in that room. So that says to me that she has either slipped or she just feels that she's skating around. So she's tense when she's walking in that room. And I don't think that should continue. So I would rather keep her out of the room or put some carpeting down. But absolutely a chiropractic or an osteopathic vet.
Sorry, do Poppy get supplements, omega-3?
Yeah. That's what we discussed last week, and that's what she's started. So that was just a follow up on Poppy.
Can I just say though, it's too late for Jane and Poppy, but there is a wonderful UK company called Floors for Paws, and their flooring is really nice.
Oh no!
Think twice before.
Where were you before? Yeah,
from somewhere else, because if you want to refloor your house or your grooming salon or anywhere to be more paw friendly, they're the people. And the lady was so nice. She had a Pyrenean mountain dog, so we bonded. You see, it was lovely. Yeah.
So what kind of, is it like for veterinary clinics and you know, dog groomers and things, or is it for private people's homes?
Anyone. It's like having your wooden floor or your tiles or whatever, like it's effectively made like that, but it's for dogs. It's for paws.
So it's got proper grip.
I mean, I've forgotten what it's made of now, but it was like, when I looked at the patterning and everything that they offered, it was like, it's really nice. Yeah.
Because that would also be nice for, I don't know, elderly people, or, I mean, if it's basically flooring with good grip, then
it's just, it could be. Floors for paws and seniors. I don't know, but this is Floors for Paws. So I just.
But Poppy just got her new floor and says there's no way she's changing.
Well, there's
so there's after the horse is bolted, but yeah, someone else will benefit. Absolutely. Yeah. Then there's Mary asks, could we please talk about anal adenomas and whether homeopathy can help you avoid surgery? Well, I'm sure I've got a couple of patients with anal adenomas are, well, if they're adenomas, they're benign tumors, but they are tumors that happen mostly around the bum. They can be inside the rectum and they can be just around the bum. When they're benign, and most of them are, we call them adenomas. If they're malignant, and a minority of them are malignant, we call them carcinomas. But Mary asks about anal adenomas, so maybe they have done a biopsy and decided that this is a benign tumor. They mostly are. They happen, and I'm speaking from memory now, but they happen mostly in intact male dogs, don't they? And they can also happen because they are kind of stimulated by testosterone and they are inhibited by estrogen. So you mostly see them, like the vast majority are intact males. And then there are some of them that are neutered females. So it's kind of the opposite. If it's in a female, it's normally a neutered female, but they're quite rare in neutered males. And the treatment is surgery. The standard treatment is surgery, where you remove them. And if it's an intact male, as it almost always is, the general advice would be to castrate at the same time, because they would most likely return if you didn't. I'm treating one particular dog at the moment with this problem, who's a very elderly dog who, when he came to me, he was neutered, but he had just had, I can't remember if it's 3 or 4 surgeries within, I mean, that's many months, because they were quite, his anal tumors were very large and they were bleeding. They bled profusely. So I mean, one time he was rushed in with just blood pouring everywhere, and they had to operate to stop the bleeding. And then he went home, and I mean, a month later, it was all back and it was bleeding again. So I think he had 4 surgeries, definitely 3 within a very short space of time. So that's why they came to me, and we're treating him with homeopathy, and he's not needed surgery since. And I'm sure that's at least 6 months. So it's absolutely possible to treat with homeopathy. As is always the case, or not, maybe not absolutely always, but certainly with this sort of situation, it will never be a situation where this is the homeopathic remedy for anal adenomas. I mean, that if anybody says that, run a mile. You need an individual assessment, and you need a remedy that suits that particular dog, but it is certainly something that's treatable. But again, it depends. Sometimes the right thing would be to operate and then use homeopathy to prevent it coming back. Other times, if the tumors are there and the vet has had a look and said that looks like anal adenomas, we could operate, but the dog is not bothered by it, then I would be quite happy to go for homeopathy and see if surgery can be avoided. Like I said, most of them are benign, and if they're not bothering the dog, then you have time to look for other options and to try and stop them growing. The problem with them is that they can ulcerate and bleed, and they can become infected, and then you have a very, very sore bum. And sometimes it can be really like you see a monkey bum at the zoo. They can be really inflamed. It can happen in any breed, but I've seen quite a lot of Alsatian German Shepherds with this. Some of those have been really nasty, like just red, purple, sore, swollen rear ends that were really uncomfortable. So if the dog is licking it all the time, or if it hurts to poo, then it's a different situation, and then you do need some treatment and most likely some surgery before too long. But that was me talking a lot. But I would say to Mary, you're very, very welcome to give us some more information so we can maybe be more specific. But the short answer would be homeopathy can absolutely help, but you need to go and see a homeopath. BAHVS.net is the website for the British Association of Homeopathic Veterinary Surgeons. Have I missed anything out yet? Have you got anything to add to anal adenomas?
And the last patient I had a carcinoma, and I couldn't. They tried to operate on it, but they came on and on. So
that's the problem with them, isn't it? That they have a tendency to recur. Yeah.
It was a very nice dog, and it was, but they had to put it down because it was very difficult.
Most of them are benign, but even the benign ones can bleed or get infected and therefore get sore. And I think the main problem with them is that when you remove them, they do tend to come back. And that's why sometimes it's homeopathy and surgery. Sometimes it can be only homeopathy, but there's definitely stuff that can be done. Yes. We need more information just to give a more specific answer, I think. Irma asks, I think she felt that we were being inconsistent. She said, before you said that a false, I think I said when we talked about false pregnancies, that, just wait a couple of weeks and it'll go away. And Emma said, but my dog's had it for a couple of months. How long should I wait and how long is okay? And I think that was me being flippant and not being accurate. A false pregnancy is a normal stage after a season, and it typically lasts between 6 to 12 weeks. Rule of thumb is that the height of it is when the dog would have given birth if she were pregnant. It can last a little bit longer than that, and some of them it lasts a little bit shorter than that. So instead of the sort of typical 8 weeks, which would be a dog pregnancy, 6 to 12 weeks is the period that the dog is under the influence of progesterone, and that's the period we call false pregnancy. I had so many comments about the conversation we had about false pregnancy. I think it was a couple of weeks ago or something, and lots of people saying, but I've been giving this and I've been giving that, I've been giving raspberry leaf and I've been giving whatever. Should I not do that then? And my answer would be that, you know, the idea of giving something for false pregnancy, I think is illogical. I don't think that makes sense. False pregnancy is a completely normal phase that happens to every single female dog that hasn't been neutered. But if a dog or the owner or the family are finding the period difficult, that may be a reason for doing something. But just because she's got milk, for instance, or just because she's a bit tired, or just because she's a bit more cuddly or a bit more barky or whatever, that's just normal. I mean, I like to compare it to a woman's cycle, and it's just the same. You know, women are under the influence of progesterone, and they may feel it, but it's not pathological. And I would only take something for my menstrual cycle if I was finding it really problematic. I wouldn't suggest that all women should be taking supplements to aid their hormonal cycle. I think that's making something that's very normal sound like it's a pathological thing, and it's not.
I had a lady come in today, actually, and I gave her your name, and I was going to send her that very video because her dog really was having problems and hadn't eaten for not properly anyway, for nearly 2 weeks, and she was stressed because the dog is possibly only under a year still, so it's possibly the second season, maybe a delayed first one, we don't know, because it emerged upon discussion that the dog was very malnourished when she was found under a bridge somewhere, and she took
wow
dog on. And so that evolved into a whole different conversation about supporting the organs and feeding organ. I got her feeding spleen because I thought really that would be useful for a dog that was malnourished. And so so we shifted completely to what she'd asked me to help her with over to what the dog probably actually needed. But I did say to watch that video, so it's interesting that that's come up today.
Yeah, I think that's really, I think
her behavior was very extremely different to how she normally is. So, but given the dog had malnourishment, that, you know, her liver will not be coping with those hormones as well as a dog that didn't have that.
I mean, there's going to be some imbalances, physical, mental, emotional, in a dog that has had that sort of trauma in life. Absolutely. And some dogs are really affected in the treatment. I've treated a dog recently that's just had a beautiful season with just gone completely through the forced pregnancy and into anestrus with no issues at all. But the 3 seasons before that, she's been hospitalized because she stopped eating and she got diarrhea and dehydrated and, you know, very, very ill. And I had to really convince her to let's go through the next one, you know, don't neuter her. I mean, and that's the main message to anyone who I think I have 2 main messages. The first one is false pregnancy is normal. So if it's not problematic, don't make it into a problem. But for those that do overreact to it and where it becomes a problem, don't neuter. You know, whatever you do, don't neuter. It's solvable. And once you've neutered, it's, you know, you can't undo it. So and that used to be the advice. If someone was suffering if you suffer from false pregnancies as a dog, it's going to come back and it's going to come back. That's certainly a pattern. So it's worth addressing, but it's very treatable.
And also don't think that the food is the issue. The dog does not want to eat, but it's not because of the food, it's because of something else that's happening. So
sure,
it's very easy for us to panic and then to start to give them some you know, juicy junk food, smelly stuff, you know, don't be thinking this is the only thing you need to do, because we've got loads of tricks up our sleeve about helping dogs to eat better and to understand them better when they're going through that sort of phase.
I think the not wanting to eat for those, it's not by any means something that all dogs experience in that phase, but when they do, I mean, they're under the influence of progesterone. So it must be a similar feeling to someone who's pregnant and feeling nauseated and you know, the perception of taste changes, and actually you feel quite sick and don't, you know, it must be that sort of hormonally affected stage. And you know,
even in her season, this dog hadn't eaten even in her season as well, so it was, you know, quite a lot going on that had sort of changed there. But anyway,
absolutely, okay. Something that can be addressed.
Yeah,
definitely. That may be the questions. Lana was asking, we were talking about maternal antibodies again, I think, maybe last week, about the timing of puppy vaccines and how the complicating issue is the maternal antibodies. No, that was when you were here. That must have been 2 weeks ago. The maternal antibodies block the puppy vaccines, and that's why we keep repeating them. And Lana asks, is it then an issue if the mum is overly vaccinated? Does that become an issue with the pups? And I wouldn't say directly. I mean, the maternal antibodies are not problematic. They're supposed to be there, and they're supposed to protect the puppy. And it's not going to, there's not going to be, I'm thinking, more, you know, there's not going to be more maternal antibodies because the mum was overly vaccinated. If you're fully covered from a vaccine, you don't make more antibodies because you keep vaccinating. But of course, if the mother is overly vaccinated, the mother's health is not optimal. So in some less specific way, that could affect the puppies. That's the best answer I can think of.
Well, for a start, the biome that she passes to
yeah.
It's really
a good point.
So that will immediately affect the immune system. So yeah, I'm sure that there will be
there would be some detrimental. You're absolutely right. I agree. It wouldn't necessarily affect the timing of the puppy vaccines, but it would affect the mother and therefore the puppies.
Okay.
Okay, Mary, who asked about the adenomas, has actually commented that it was an abscess and it was bleeding. A sample has been sent off, so hopefully it will be okay. I would absolutely say that if it isn't, she's probably going to get some antibiotics, and if it settles, it settles. But if it doesn't settle, see a homeopath. Oh, dog's been under anesthetic today, and an abscess has been flushed out. So it could have been an abscess from the same root, or it could just have been any abscess, maybe an anal gland abscess even. Get back to us if it's not solved, and see a homeopath if it's not solved, really, is what I would say. There's one more question here. Have we got time? Yes, we do.
Well, Tina says... I have as well, but go on.
Oh, go on. No, you go first. You go first.
Well, no, I mean, no, we will put our watching Guardian's dogs before mine.
Tina says, another vaccine question. The DHP insert states that you should vaccinate healthy animals only. This is obviously vague and open to interpretation, but I wondered if there was any guidance given to vets regarding this statement. That's a really good point. I'm always saying this. It is certainly taken very lightly sometimes. There isn't any general guidance on how to take that, no. And chronically ill animals are obviously vaccinated, though I think it's a statement that should be followed more, personally.
So do I for sure. So do I. I mean, so I wanted to ask Jette about, so anal glands, okay, things we're talking kind of about that. This can become a big issue, and obviously as nutrition consultants it comes up quite a lot, and we consider the diet, and we consider if they are being fed something that would encourage expression, the bone content changes, possible prebiotic fibers, this sort of thing. But how related to the structure of the body would be the anal gland expression? Do you think that perhaps diet is even there one part of the story, and actually if you could shift the fascia, that the anal glands would express more easily.
Yeah, yeah. That is definitely the case in some cases. Now we have the bottom. So if you have changed the food and made sure that there is enough bone content so that the texture of the feces is hard enough to, then it is a good idea to get your osteopath to check if the fascia lines are released. And sometimes when the sacrum is locked, or the tail of the basis of the tail is locked, you can have a problem in the perineum, and therefore have lesser force when the dog sits down to poo. I would get it checked if it continues to be a problem. But sometimes it's a bit overweight, the animal, and therefore it's more difficult for the bowel movements to empty out the anal glands.
Yes, I've seen that as well. I think it's just important to understand all the different aspects. So because as nutrition consultants, obviously we can get very stuck on food, obviously, but I just feel it's really important to understand all the different aspects, and when is the time that you say to this guardian, actually, we've done all we can with food. I think you need to see somebody who can support the fascia of the dog, or the lymphatic system of the dog, or, you know, a different approach kind of thing.
I mean, I say in my book that I think if a dog has had repeated anal gland issues, I mean, certainly if there's been infection or an abscess, but even if you have a dog where you go back to the vet repeatedly to have them express the anal glands on a regular basis, which I think is it's problematic that a lot of groomers and a lot of vets, a lot of vet nurses tend to do that as a kind of extra service, you know, like they're kind of putting sprinkler fluid on your car or something at the garage. It's like, oh, now that you're here, I'll just check the anal glands for you. And I think that's such a big no-no, you know, hands off if they're not really problematic, because you're going to be creating a problem there.
Yes.
But if there has been a problem there, or there is a sort of need or a perceived need to keep helping the dog express these anal glands, I think seeing an osteopath is definitely on the cards, because either they're not being emptied properly because they're sore, or they're sore because there's been issues there. So whichever way around, whatever was the chicken or the egg, there's going to be some tenderness. Just to back up what Jette is saying, I absolutely agree.
I think when we look to human beings, there have been very good research that if you you know, the 8-16 fast, that you shorten the period when you intake calories, and make sure that you have enough of prebiotic fibers and vegetables. Then it's easier for the good microbiome to be held alive and fresh and kicking. So maybe the canine guardian should consider maybe not feed the dog all over from early morning to late in the evening. Maybe they should shorten it a bit up, because that works for human beings to make the bowel movement more stable and the microbiome more stable.
Yeah, fasting is so important.
Yeah.
I do teach that.
It does not have to be a whole day, but maybe elongate the night a little bit so that they get their breakfast a little up in the morning, or maybe at lunchtime.
But I mean, we say that as if all dogs get breakfast. I think most healthy dogs don't need more than one meal a day, you know.
Yeah,
but I mean, some get fed several times a day, but that can be the root of a problem, I find very often.
Yeah.
Yeah.
I only think that the problem is if they get the food once a day, and then it kibbles and it just stands there and it gets boring in the tray. Then I would more like, I prefer that they activate the dog and give it as treats instead.
But we're assuming that our enlightened audience don't feed kibble, aren't we, Caroline? We're
Yeah. you're one of our fans and you do feed kibble, we can help you.
Yes, we will let you live. That's all. We will let you live. We have spent our time. Thank you very much to Jette. And
thank you for having me.
It has been really interesting listening to you. I'm
And
going
I
to stop.
must say happy birthday, Tina.
Oh yes, it's Tina's
That's right,
birthday.
it's not here.
Everybody, happy
Happy
birthday to
birthday.
Tina. Happy birthday, Tina will be the last words. Happy birthday, Tina.